Thank you very much. I am Kevin Cass-Ryall, and I've been with Ramsey Healthcare for 20 years. It's been a great part of my life, I must say, and prior to that I was in the public health system here in WA, so I've been in WA health, either public or private, for 32 years now. I was only 16 when I joined, of course. But so Ramsey Healthcare is a little bit about that, and it's only a little bit, but it's 50 years old this year, so we're celebrating our 50th year. It started 50 years ago with one small 17-bed mental health facility in New South Wales, in Sydney, which Paul and a psychiatrist mate started. And Paul knew nothing about hospitals, and the psychiatrist friend said, if we could buy this facility and turn it into a mental health facility, I'll keep it full. If you don't tell me what to do from a doctor point of view, I won't tell you what to do from a business point of view. And they were lifelong friends and have been. They've both passed away now. Unfortunately, Paul passed on the 1st of May this year. Paul was a personal friend of mine. Like I said, I've worked for him for 20 years. He used to come to my house for meals and things and knew my kids, and he was a really close mate. So his passing was really traumatic for a lot of us that have been around with him for a long time. And one of the attributes of Ramsey Healthcare is that a lot of us have been around a long time. It's a really great culture. It's a very values-based organisation, and we basically try to do the right thing. Our motto of people caring for people, as well as of caring for patients, it's also caring for each other, and it's a great organisation. So we are deeply saddened that Paul has passed, but he's also done something that's quite amazing. He was the major shareholder of Ramsey Healthcare, and it was worth around about $3.5 billion, that shareholdership, and he's set up a foundation a few years ago of the Paul Ramsey Foundation, and the vast majority of his shares, around about $3 billion worth, did I say billion or million? $3 billion worth have gone into that foundation, and all of those proceeds from that shares will go to charity each year. So that'll be somewhere between 50 million to 70 million, depending on the dividends. Every year for in perpetuity will go to charity in Australia. So it's a fantastic legacy that Paul has created. But Ramsey Healthcare itself, it's like I said, it's got the largest private hospital operator in Australia. We're 69 hospitals here in Australia, and we're 212 in 5 countries now throughout the world. So it's become a massive organisation. We've got 69 in Australia. We're now the largest private hospital operator in France also. We've got 101 there. We've got 38 in the UK, 3 in Indonesia and 3 in Malaysia. So when I joined the company, we had about 11 hospitals here in Australia. So it has been an amazing journey. And you can see that we have a lot of beds. Obviously, it's a KPI of our industry, but we also are a large employer. We employ 50,000 people in the world. There's about probably 30,000 of those are here in Australia, and about 6,000 here in Western Australia. And we treat 2.5 million people a year, so it's quite a large organisation. And as of 1st of June last year, we took over the management of Peel Health Campus. So, and we were very pleased with that. Peel was constructed or opened in 1997 and was managed by a prior private operator. It is a public-private arrangement, so we have a contract with the public health department to provide services to public patients, and the vast majority of patients at Peel are public, but there also is a private wing, and I'll talk in a little while about what we're hoping to do at Peel with the facilities. So it's a contract, but it's a relationship as well. We also run Joondalup Health Campus in the north, and have done so for the last 9 years. So it's interesting looking at what's occurred in the Joondalup region, which obviously was one of the fastest growing areas in Australia, and you look at the Peel region, which is now one of the fastest growing regions in Australia. So if the journey of Joondalup, if we look in the Joondalup Wanneroo area, is probably the journey that the Peel region is going to go on. and particularly the hospital from our point of view. So here so you'll see what Peel Health Campus is at the moment. It's 127 beds. It treats both public and private. It is a partnership, and it has a busy emergency department. There's about 46,000 people going through the emergency department each year, and it certainly wasn't designed for that level of activity, but the staff there are fantastic. We've been really impressed since we've taken over the management of Peel, and I see Diane Barr, who's the Director of Clinical Services, Director of Nursing for normal people, but Di's here and is a great Director of Nursing, but the team at Peel are very skilled and very great attitude and great quality of care that they provide, and hopefully with Ramsey's involvement that we can improve services even more and expand services. Other places in WA that we have, so we've got 5 facilities in WA, obviously Peel, Attadale, which is a small private hospital in the suburb of Attadale, about 38 beds, and then we've got Hollywood, where I've been the CEO for the last 15 years, up until 2 years ago. And then when we took over Hollywood in February 1994, it was the old repat. It was 300 beds. It was provided good care, but it was very, very old, and that's now been redeveloped and continues to be redeveloped, and is currently 660 beds. Private hospital with lots of good facilities. Then we've got Glengarry in the northern suburb of Duncraig. It's around about 110 beds. And then Joondalup, which is now 664 beds. So we've got the full range of a small facility at Attadale to the massive facilities of both Hollywood and Joondalup. So the Peel region, it's interesting, you always have little slight differences in statistics, but the 2011 census indicated that there's 112,000 residents. And this is the local government areas of Boddington, Mandurah, Murray, Serpentine, Jarraldale and Waroona. And obviously the major population, 65% of those are in the city of Mandurah itself. And then there's also a lot of visitors. You can see there 63,000. And the average, they stay for 4 days. So all of these obviously require health services because, as we all know, when people go on holidays, etc., as well as local residents, we do have injuries requiring emergency departments. And Mandurah itself is really a lower socio-economic area. When you look at some of these statistics, so it's low income. You can see here that the median household weekly income for Mandurah is 984 compared to WA, which is 1,415. That's quite a big difference. And research shows that lower income people tend to rely more on public health and health services. Lower education, so Mandurah is 12%, have post-school qualifications compared to WA of 22%. My son will be very pleased about not everyone getting obsessed about ATAR, because he is at the moment. High unemployment. We all know that Mandurah has high unemployment, which has its issues in itself, but from July to September this year, unemployment in the area was 9.5% compared to the metropolitan Perth of 4.5%. So it's more than double. These are significant statistics that do have health and other government services implications. And unskilled jobs. Mandurah 46% compared to the state 41%. So it has a few challenges. I like simplistic graphs that show a picture, and I think these bar charts also show a picture. There are significant health issues across the region, and statistically again, this includes Rockingham as well as the Peel region, so it's not purely Peel, but this shows the 2011-12 smoking rates in the Peel region were higher than the state average, as is obesity. Like the difference in obesity for the Peel region compared to the rest of Perth, 38% compared to 27%. It's a major issue that's coming towards us, and we all need to be aware of that and take actions. That I find it interesting. My daughter, who's 33, lives in Mandurah, and she lives near the cut. And I got amazed the other day, it just struck me how many takeaway food places there are in the shopping centre along there. Any takeaway product you want, you can get in that shopping centre, which is a bit of a worry, really. And long-term conditions. So these are self-reported, people indicating that they have a long-term condition. And you can see there that nearly half the residents in the Peel region say they have these. So the Perth South Coastal Medicare Local published a report earlier this year, and it consulted with a lot of stakeholders, and these are some of the priorities that it says that is required in the Peel region. And to be blunt, it's everything. It's Peel is, we'll go through some of the population stats, but Peel's going to need more of everything. There isn't anything that I could see that we don't require in this region. So this gives a pictorial bit of the population, and basically what it's saying is in the next 15 years, Peel region's going to double in population. So all the services that a community require need to move in line with that, including obviously health and hospital services. So the main areas obviously would be Mandurah, Serpentine, Jarrahdale and Murray, but doubling population in 15 years is significant. And for us in health, it's not only the volume of population, but it's the mix of population. What's the age profile? Statistics once again show that when you're in the older age group, you have higher demands on health services. So this graph is showing that 0 to 19 age group population, so not necessarily percentage, but the population will increase by 64%. The 20 to 39 will increase by 60%, and the 65 plus is going to increase by 135%. So that's certainly significant demand coming towards us. We are developing plans from a hospital perspective, because obviously we do not provide services in the community. That's more the public health domain. But we asked the consultants that we use, Hards and Associates, who will do a lot of analysis of demographics and health requirements, etc. We asked them how many people living in the region require hospitalisation and how many in the future. So you can see on this graph that in 2012-13, Peel residents received 114,881 hospital treatments, ranging from emergency attendances to emergency surgery, planned surgery, elective surgery, general admissions, etc. And some of those were at Peel Health Campus, and some of them were at other hospitals, Rockingham, in Perth, etc. And this graph is showing that in the next 15 years, there's going to be a 120% increase in demand for health attendances, hospitalisations and EDs. So they're big numbers. The consultants also calculated how many beds are needed to treat the increased number of patients. So you can see the growth in the beds required for public and private. Once again, very significant. Obviously, Fiona Stanley coming on stream. So not all these services are going to be at the Peel Health Campus, but it'll be a combination of Peel Health Campus, Rockingham, Fiona Stanley, other hospitals in Perth. But it's, as a taxpayer, it's obviously better to keep those patients who can stay at a facility like Peel Health Campus at Peel Health Campus than sending them up to the more expensive, tertiary hospitals. But obviously the tertiary hospitals ideally would provide the care at the higher end of acuity, and where we can retain people in the local community is advantageous from an economics point of view, but also from a visitation and convenience to the patient, convenience to the patient's family and friends to stay in the local area. So this is, like I said before, we basically need more of everything. There isn't much that we don't need in this area. So there's going to be more births, there's going to be more emergency attendances, more surgery, more admissions. Mental health will continue to grow in demand, and with the ageing population, there'll be need for cancer and heart and dementia and all those more mature age type things. So what Ramsey's have been working on is looking at a development proposal for Peel Health Campus, and this outlines what we're thinking at the moment, that there'll be additional public beds, that we will build a separate private hospital on the site. So we'll have a public facility and a private facility on the one the block, on the one footprint. It'll be, in that way, it's similar to Joondalup again. Joondalup, we've just built a 145-bed private hospital, and we've expanded the public facility there, and there are some services that you share, support services like catering and the central plant and things like that, so it works out from that point of view. So what we're looking at the moment is an additional 40 public beds, an additional 33 private beds, but they will be in a separate private hospital, doubling the number of operating theatres, so an additional 4. They've currently got 4, and currently 1 procedure room would add another one, so we're virtually doubling the surgical capacity. Additional birthing suite, increasing the capacity of the emergency department, increasing capacity of dialysis and day chemo, and building some consulting suites so that we can attract and retain more specialist doctors to be providing services in the area. And the beauty of Peel is that it does have a large block of land that will cater for quite a significant amount of expansion. So this, once again, this is ID. Consultants called ID have developed a population growth through to 36, and that shows even more growth. So Mandurah increase from 2011 will be up to 60% increase. Serpentine Jarrahdale will increase 3 times, and Murray will increase 2.5 times. So as I have the benefit of looking after Joondalup as well as Peel and the other hospitals here in WA as part of my role, and I can see, like I said, what I keep on, when I'm talking to people at Peel Health Campus, I keep on referring back to Joondalup Health Campus, because I just see there's so much similarity between the journey that Peel is going to go on to where Joondalup and the region up there has what they have experienced. So thank you for your time, and I look forward to any questions. Thank you.